This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. A woman in labor was put in front of a judge while lying in her hospital bed. She wasn't accused of a crime. She was refusing a C-section, and the state stepped in to decide for her. Let me ask you something. Do you believe a patient should always have the final say over their body? Hold that thought. Hold that thought. Let's talk about the case. In reporting by ProPublica, a Florida woman named Charisse Doyley was in labor for hours when something unexpected happened. A nurse came in and told her to cover up. Then a tablet was placed in front of her. On that screen, a judge, lawyers, hospital staff, a court hearing had been called. Not by her, by the hospital. Have you ever heard of a courtroom being brought into a hospital? Because most people haven't. She wasn't refusing care. She was refusing one specific procedure, a C-section. She had already had multiple surgeries. One of them led to complications. She understood the risks, and she made a decision based on those risks. She wanted to continue laboring unless it became an emergency. The hospital saw it differently. They believed the risk to the baby was too high. So they went to court to get permission to override her decision. Let that sit for a minute. At what point do you think a doctor or a hospital should be allowed to override a patient? In most healthcare situations, you can refuse treatment, even life-saving treatment, even if that decision could cost you your life. But pregnancy changes that dynamic. And this is where the system becomes very different. The rules are not the same. Courts can step in based on something called the state's interest in protecting the life of the unborn child. This is connected to a broader legal concept: fetal personhood, where the fetus is given rights sometimes equal to or greater than the person carrying it. Do you think 2 lives automatically means 2 sets of legal rights? Or should one person still have full control over their body? Drop your thoughts in the comments. Now, this is not an isolated case because another woman, her name was Brianna Bennett, went through something very similar. also in labor, also refusing a C-section, also brought into a legal situation inside the hospital, and she was ultimately forced into surgery. When this happens more than once, it's no longer just a case or a one-off. It's a pattern. And experts have pointed out Florida has seen more of these court-ordered interventions than many other states. Now, does that feel like protection or does it feel like control? And here's where it gets even more complex. The American College of Obstetricians and Gynecologists has stated, forced C-sections are ethically impermissible, meaning even within medicine, this is highly controversial because it challenges autonomy, consent, bodily integrity. Imagine this moment. You are in labor, in pain, exhausted, and suddenly you are expected to defend your medical decision in front of a judge with no lawyer, no preparation, no advocate. Do you think someone in labor can truly give informed consent under that kind of pressure? Both women highlighted in these cases are Black. That has raised questions, not conclusions. We're not drawing any conclusions here, but just some concerns, right? Because historically, healthcare disparities have existed. And trust in the system is not equal for everyone. I just posted another video of a woman who was in labor, I think it was in Texas, and she was not getting the care that she needed. Do you think everyone experiences the healthcare system the same way? From a nursing perspective, this creates a very difficult position because nurses are taught to advocate for the patient, respect autonomy, and support informed decisions. But in situations like this, the system may override the patient, and the nurse is left in the middle. And there's a bigger question. This is not just about one woman or one hospital. It's about a bigger question. Who has the final say over the human body in healthcare? The patient? The provider? Or the state? Because in most areas of medicine, you have the right to refuse care. But in pregnancy, that right is not always yours alone. Do you agree with that? Or should that change? I really want to hear your thoughts on this one. This is The Broken Shift. Hit that like button, subscribe, hit that notification bell, and I'll see you in the next one. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.